You can come up into the posterior deltoid as well. Just on your side, down to the deltoid tuberosity, up towards the acromion. Don't put too much weight into this position. It can be uncomfortable. Again, these are for healthy individuals, use techniques. We're not doing this on anyone with some pathology. But again, treat the humerus like a cylinder. Roll anteriorly to posteriorly to get the different insertion, different fibers as they come down and insert into the deltoid tuberosity. You can have your arm out straight like this to get towards that posterior capsule. We're not really going to get to the posterior capsule, but you will get into the posterior deltoid. You will get into the long head of the tricep, and you are going to address the posterior rotator cuff as we talked about. I am going to encourage you to try this if you have not. Roll your body from serratus anterior all the way back to lateral border of the scapula and that posterior aspect of the scapula. So we're not just rolling top to bottom, we're moving medial to lateral as well. We're rotating. You can find and access some fibers quite differently. If I do want to move on to address the rest of the tricep complex, I can go all the way up to that olecranon process. I can work through all three of the bellies, the long head, the short head, and the medial head of the tricep. I would be cautious about dropping too much weight into this position. You can put some strain into the shoulder, so you are going to use this hand to control you. But do change the position of the humerus. Get more into that lateral aspect of the humerus. Get into the posterior aspect of the humerus. Many times and you get a little stretch on the triceps here as well. That long head of the tricep is usually aggravated from trying to stabilize the glenohumeral joint because of its insertion point onto the glenoid. If you have weak shoulder stabilizers, then you're going to have muscles like the lat, like the long head of the tricep, trying to make up and provide some tone and some support through there. Especially if you've had some trauma in your passive system, such as the ligaments and capsule overstretch, you're going to have a lot of tonus around that area. Be careful about releasing too much of it, but this might help you work with the joint a little bit better.